Hello, my name is Adam Riedel. This is my BSN225 subcutaneous medication injection video. So for this, I'm going to need a few things. I'm going to need my provider's order for heparin, my multi-dose vial of pretend heparin, some gloves, some alcohol swabs, my patient, which is in the other room, my hand sanitizer, and then my needle. In this case, I have a 1 milliliter needle. That's 25 gauge. That's 5/8 inch. I can go a 1 to 3 mils is fine. 25 to 27 gauge also fine, and then 3/8 to 5/8 for subcutaneous. So I have verified the heparin order in the MAR that the provider ordered for 1,000 units. For this case, the vial we have is 10 milliliters is 10,000 units, so dividing that by 10, 1 milliliter will be 1,000 units, which is what we're going to be giving. And I want to just kind of keep in mind the 6 patient rights of medication administration, which is the right patient, the right time, the right medication, the right dosage, the right route, and the right documentation. So I got all my supplies. I'm going to go on the patient's room, knock, knock, go in, and then shut the door for their privacy and ask for their name and date of birth.
Amy Riedel, 21093.
And Amy, do you have any allergies to food or medication?
No.
Okay. So Amy, the reason why I'm here with you today is I'm going to do your subcutaneous heparin order that the provider ordered. This is for blood thinning, so if you have a clot, or sometimes prophylactically prior to surgery, we'll give people a heparin shot if they're going to be in a sitting or similar situation for an elongated period of time. But for this, you might experience bleeding, you might experience blood in your urine, you might experience fainting or dizziness, and like a normal paper cut, you might be bleeding a lot longer than previously expected. So let us know if you have any of those sort of side effects. Do you have any questions?
No.
Okay. So let's go ahead and do this subcutaneous heparin injection. I gotta really get my hands dry for these gloves because they're just a wee bit small. But that's okay. So, Amy, what we're gonna do here is I'm gonna get some alcohol on my vial. I want to also make sure that it's, since it's a multi-dose, I want to make sure that it's within the range of it not being expired, because I don't want to give expired drugs. That would suck. We're going to pretend that the trash can's right over there. And I've got my needle and syringe. And my order is for 1 ml. If I can get this dang thing opened. And I'm going to just inject some air prior. And since it's 1,000 ml or 1,000 units, I'm going to do 1 ml of this heparin solution in this multi-dose vial. And I want to just inspect, make sure things are looking good. Give it a little taparoo to get rid of the air bubbles. And then I'm going to inject this into the subcutaneous part, the fatty tissue of her upper arm here. And I'm going to give an alcohol swab, and then I want to do this at a 45-degree angle. And I kind of want to be pinching the fatty part of the back of her arm for this. Okay, maybe you're going to feel a slight pinch and burn. Okay. And then just hang on tight. You're good, you're doing all right. Okay. And I have my gauze, and we'll just use that. And I want to make sure I cap this until I hear it click. And then dispose of this in a sharps container. Beautiful. Amy, do you have any problems or issues right now? Feeling okay?
Yep.
Cool. If you need anything else, let us know. Give them their call light, and then I want to make sure that I'm documenting that I administered this medication prior to and not forgetting to hand sanitize as well. Thank you very much.